All of you can give your attendance in the chat box. Don't wait till the end of the class. Okay, this is a very short chapter, as you can see. This about disease. Okay, very short chapter. So, disease, all of you know. So, what do you mean by disease or any disorder or disease? What do you mean by disease? Not this. This is the definition for disease. Okay, not this kind of what to say, bookish uh, definitions. Can you hear me? Am I audible?
Yes, ma'am.
Yes.
Oh, okay.
Yes, ma'am.
Okay. So what happens is here during discussion of those control and coordination, I discussed about the coordination, right? That all the organs and all the organs of your body and everything that is in your body, not only the organs but the you can say the tissues and all those uh, muscles, blood, and all those. So all those need to work together in order to lead a healthy life in order for a person to survive, right? Every organ and every thing that is in our body needs to work together. It needs to work together, and so that like an individual remains healthy and he can survive a healthy life, right? So when what happens when, like, for example, let's take an example of the skin. Okay, skin is an organ. All of you know skin is an organ, right? So please mute yourself. Whenever you want to speak, you can unmute and speak. Okay, so what happens? Let's take the example of the skin. Skin also plays a very important role in our body, right? Without the skin, how will you will not be able to survive, right? You will be all infected, and all the bacteria and whatever in the environment, in our surroundings, or in the air, you can say, not lots of impurities are there, right? Lots of impurities are there, and lots of like germs and bacteria and viruses roam around. But our skin, our body don't get infected because of the protective covering that is the skin, right? And without the skin, if the like blood and all will be exposed, if your muscle will be exposed, then it will get infected, right? It will get infected. And also skin plays a very important role. So without the skin, people will not survive. Okay, people can survive first like few uh, days, months, I don't know, in the hospitals. That is different case, but normally a person cannot lead a healthy life. Okay, so the skin is very important. So just imagine the skin is an organ. Okay, so like there can be diseases of the skin diseases are there, right? Some like rashes are there, those some skins, they come off, they become dry and they come off. So all those diseases are there, itches are allergies, all those skin diseases are there, right? So those are diseases which causes effect to the skin, and skin is an organ. So which means when disease is something which causes harm to one organ or maybe many organs, maybe you can take one more example of a disease like what is it, Okay, let's take the example of AIDS. AIDS. Okay, AIDS. AIDS actually, what does AIDS infect? What do you think AIDS infect? AIDS is a disease, right? AIDS. Autoimmune deficiency syndrome. AIDS. You know the full form of AIDS, AIDS, autoimmune deficiency syndrome. So what is autoimmune deficiency syndrome? So what happens when people suffer from AIDS? So what happens is that your immune system is totally disrupted. It is totally it becomes means dysfunctional. Okay, so your immune system will not function, and what will happen when your immune system will not function? When your immune system will not function, you will be having many other diseases, because your body cannot save you, or body cannot fight against all those diseases. See, I have already mentioned, like in the atmosphere there are lots of viruses and germs and bacteria roaming around, right? It can get inside your body at any time, but due to your immune system you don't get sick every time. Otherwise, without the immune system you will not survive, because in every second, in every microsecond, you will be infected with one or the other thing. Okay, now also you are getting infected, but then it cannot like impact on your body, because your immune system is strong enough to like get rid of those viruses and bacteria which are affecting your body every minute. Okay, but without the immune system you'll get infected and you'll get the disease. Okay, you'll have cold, you'll have all the other diseases. Okay, uh, that is AIDS. That is why AIDS, the person suffering from AIDS, they do not have only like a few symptoms or only one or two symptoms. They will have different symptoms. Okay, for some people it will be like some organ will be failure will be there, some other diseases might occur, and many diseases will occur. Okay, the cough and cold all will be there. Then many other diseases will also occur, and in the later stages some organ failure will be there, like that. So that is an autoimmune disorder, which involves like the immunity is disrupted, and the immunity or immune system of human beings. Immune system, I already discussed a little bit about the immune system while discussing about blood, right? While discussing about blood and blood proteins, plasma proteins, I discussed a little bit about human immune system. So that immunity is very important. Okay, so without the immunity you will have plenty of other diseases. You will not be uh, staying healthy. You'll have many diseases. So that AIDS, when a person is infected with HIV virus, AIDS is caused by HIV virus, right? So, the HIV virus, when a person is infected by HIV virus, so AIDS, the disease is known as AIDS, and the virus is HIV. So, when a person suffers from AIDS, he will have those. His immune system will be very weak, and his immune system will not perform the way it should perform. Okay, and that is the reason why he will have many other diseases, and his body will not be susceptible to like all those bacteria and viruses roaming around, right? So he will have many diseases. That person will have many diseases, and that will like at the later stages it will result in many organ failure. So getting back to the like disease, so disease is when, here see in the definition is given, a state when the functioning of one or more organs of the body is affected, which means one or more organs. Like in the case of AIDS, after like in the later stages, not it might not like only one organ failure, it might be many, or it might be one also. So when one organ is affected, or one like more organs are affected, like for people with asthma, the lung is infected, right? Lung is infected, so that one organ, lung. Then for people with cancer, it might be different cancer. Some people have breast cancer, some people have like prostate cancer, some skin cancer, throat cancer, blood cancer, many leukemia, right? So many types of cancer is there. So whenever the organs that are in our body, there are organs in the body, right? So whenever those organs they get infected, they result in diseases. And what are the symptoms? What will the symptoms like? See, whenever that one or if like more organs are infected or affected in your body, then they will show symptoms. Right, let's take the example of asthma only. So asthma, asthmatic patients, they they suffer from uh, means their lung is infected. Okay, their lung is infected, and that is why they like find it difficult to breathe, and like they find difficulty in breathing. Okay, so that is for asthma patients. Asthma also we discuss a little bit while discussing about those respiratory system, right? So that asthma. So asthma, well, it is like when the person will find difficulty in breathing. That is the lung will get infected. Okay, and the symptoms. What are the symptoms when the lung will get infected? The symptoms are the person will signs and symptoms here we are talking about. The signs and symptoms are the person will find it difficult to breathe. He will like normally a person breathes for about like in a minute he will breathe a particular amount of time, right? So that will be like different. He won't be able to breathe, so as a result if a person won't be able is not able to breathe, what will happen, he will not be able to supply his body with oxygen, right? And then he will become anemic, means oxygen level will be very less in your body, and it will cause many other means problems also. Okay, so those are the signs and symptoms. Like for asthma, the organ which gets infected is lungs, and the signs and symptoms are difficulty breathing. Okay, so hope you have understood the definition. That is the state when the functioning of one or more organs of the body is affected. That is, for asthma, you can take the lungs. Lungs is affected, okay, and then resulting in psychological state with resulting in altered psychological state, which means like psychological state means the normal human being when you're a healthy human being, right? Healthy person. So that whole state is changed. Altered means changed. The whole state is changed by so those signs and symptoms that normally you are breathing all well, right? Those when your lung is getting infected, those you are having asthma, then you'll find it difficult to breathe, which means your state whole your physical state is changed, and uh, that is when you will get to know that you have a particular disease. Okay, so disease is what? Disease is something which happens when one or more organs of your body is affected. Okay, and there are two types of diseases. There are two types of diseases. That is infectious and non-infectious. Also, it can be said communicable and non-communicable. Same thing. Okay, infectious and non-infectious, communicable and non-communicable. So, infectious diseases, what is uh, the difference between infectious and non infectious? So, infectious diseases are those diseases which can be transmitted like from one person to another. Transmitted means which will transfer from one person to another. Okay, suppose this is the examples are common cold, AIDS, malaria, tuberculosis. Let's take common cold. Common cold is very common to everyone. Everyone suffered from like several times in their like life. Common cold, right? Those fever and common cold you are having. So the viral fever, no, that one. So common cold. What happens? It when I guess you have noticed like if one family member gets it, the entire family suffers from the disease, right? It is not a very serious disease, but please mute yourself. Please mute yourself. Omem Sibo. And Dia. See, this is very disturbing. No, don't do that. You can mute yourself, and whenever you want to speak, you can unmute and speak. And if you have not given your attendance, please give your attendance. Don't give it multiple times, just once is enough. So whenever one member of the family is infected with common cold, the entire family gets it. Why? Because the virus, the common cold, is caused by a virus known as rhinovirus. Okay, the common cold is caused by a virus known as rhinovirus. This one, rhinovirus. So, okay. So this virus, it can spread from one person to another. Okay, it can spread from one person to another. Like you're having the virus, that is, you're having common cold, and if you are in close contact with someone else, that person is like most likely to get that, because the rhinovirus, it can transmit through the air. Okay, through air it can transmit. Like when you're speaking, when you're sneezing, it's gone. Then like when you're even speaking face to face, then it that virus is most likely to travel through the air from your mouth to the other person's mouth or body or whatever, right? So that is why this common cold, it can transfer from one person to another. Okay, and those infectious diseases, or you can say communicable diseases, are those diseases which can transfer from one person to another. Okay, and medium of transfer may be different. Like for the AIDS, for common cold, even if you sit beside a person who has common cold, you will get it. You are most likely to get it. It's not like 100%. You will get it like 80%. You'll get it. Okay, but for AIDS, it is not that. For AIDS, you have to blood transfusion should be there. Like you have to share the same syringe. You have to, or you have to like means blood from the one person to the other. Blood must be transfused. Like otherwise it will not transfer. Like whenever you are sitting, eating, sleeping with an AIDS patient, you will not get it. Okay, but if there is blood transfusion between the two persons sharing the same syringe and stuff like that, then then AIDS will be transmitted, because AIDS is also done caused by a virus, that is HIV virus. Okay. Then there is malaria. Malaria, all of you know malaria is caused by mosquito, right? Those Anopheles mosquitoes. This one, Plasmodium vivax. Okay, Plasmodium vivax is the virus, and uh, uh, um, it is caused by mosquitoes. So that since it is caused by a virus, that is why it can also be transmitted from one person to another. Right? A malaria person having malaria, if the same mosquito goes and bites you, you will have the same disease. Tuberculosis also, it's same. Tuberculosis, it's a disease of the skin, and a person with TB. Oh, sorry, it's not. Tuberculosis is not a disease of the skin. I confused it for leprosy. Okay, tuberculosis, it's TB, like cough disease, that is also transferable from one person to another. And leprosy is there, the skin disease, right? So that is also transferable from one person to another. So all the diseases that are caused by any virus or bacteria, that it will transfer from one person to another. Okay, and those diseases are known as infectious disease. Okay. Next is non-infectious disease. What are non-infectious diseases? Non-infectious diseases are those diseases which cannot transfer from one person to another, which will not like go from one person to another. Okay, those are known as non-infectious or non-communicable disease. Okay, and those diseases are generally not caused by any virus or bacteria. Those non-infectious diseases are not caused by any virus or bacteria. For example, you can take cancer. Cancer is not caused by any bacteria, virus. Cancer will not spread from one person to another under any circumstances. Even if you take blood, even if you take whatever it may be, it will not transfer from one person to another because cancer is a disease which will affect maybe the blood cells, maybe the your what to say your DNA is okay. The DNA may be disrupted, DNA structure may be disrupted, maybe some rays got inside you, then all those the what to say the DNAs and chromosomes, the structure it might be changed, and that is why cancer occurs. Okay, and that is why it cannot transfer from one person to another. Hypertension and diabetes, same. These are done by like hormones. For diabetes, it is insulin and glucagon, insulin hormone, right? So hormonal things they won't transfer from one person to another. Okay, so non-infectious diseases are those diseases which can transfer from one person to another, and those diseases are generally done by viruses and bacteria. Okay, and non-infectious diseases they cannot transfer from one person to another, and those diseases are not caused by any virus or bacteria. Those diseases are like some other hormonal factors or like external factors. Okay, so those are non-infectious diseases. Okay, this is a chart of those diseases which are caused by this viruses and bacteria. Okay, typhoid. Typhoid. Nowadays, people do not suffer from typhoid that much, but in the earlier times, typhoid was a very common disease. Okay, so typhoid, many people died of typhoid. Typhoid, it is caused by Salmonella typhi. This is the type of virus. Okay, these are viruses and bacteria which causes the disease. That is typhoid. So this is a scientific name. Okay, Salmonella typhi. Salmonella is the genus name, and typhi is the species name. We have, I guess, we have studied this in your what to say, botany, binomial nomenclature. Right. And what is Weidel test? Weidel test is the test done to detect typhoid. Okay, this is the name of the test. Like, for example, blood test is done and urine test is done, right? So, same here, Weidel test. There is a test named Weidel test. Okay, this Weidel test is done to detect typhoid. These are the symptoms. And there is pneumonia, common cold, malaria, dysentery, ascariasis, elephantiasis. Elephantiasis is that big foot, the person having that big foot. Not so common disease. Okay, then ringworms. So ringworms is little bit common, not that much common. Those itchy skin, no? So people will have so much itchy skin, and there is a ointment, the ring guard, that helps to to like stop or kill this particular microorganism. Okay, these are the symptoms and these are the effects. This chart you need to learn. You need to learn the mainly the causative organisms and the symptoms. What are the symptoms and what happens? Okay, this chart is essential. I will give this PDF in the group. So this is all about diseases. It's a very short chapter as I have already mentioned. So any doubts from this chapter, you please ask. Any doubts from this chapter? And those who have not given your attendance yet, please give it. In case of doubts, you can ask. And if you don't have doubts, you can leave. If you have given your attendance, you can leave. Once you have given your attendance, you can leave. Those who have no doubts. Any doubts, you can ask.
Ma'am.
Hmm. Yes.
Hello, ma'am.
Yes, yes.
Can you
Listen.
explain again tuberculosis?
Tuberculosis. Wait, okay. I'll just copy the this one attendance and then I'll get back to you. Okay, so tuberculosis, it is a, what to say, it is an infectious disease. Okay, why infectious disease? Because it is caused by a virus or a bacteria. In the case of tuberculosis, it is caused by a bacteria known as Salmonella typhi. Okay, sorry, you are asking typhoid or tuberculosis?
Tuberculosis.
Tuberculosis, okay, okay, I'm discussing about typhoid, okay, sorry. So tuberculosis, it is also an infectious disease, okay, it is an infectious disease caused by a virus, okay, the tuberculosis, and since it is caused by a virus, that is why it can be transmitted from one person to another, okay, since a virus is involved. So whenever a virus is involved, it can like transmit, and in the case of tuberculosis it will transmit through air, okay, through air, if a person like sneezes or like uh, coughs, you can say, so then that virus will transmit through the air, okay. TB, there is a virus, TB virus, okay, and that will transmit through the air, and the other person will be infected, and that is why it comes under infectious diseases, okay. Also it can transfer like if the person, if they share the same food or like same plate, eats on the same plate, then also it will be transmitted, okay. So that is what tuberculosis is. Tuberculosis is a bacterial disease, okay, that is caused by a bacteria, and it generally infects the lungs, disease of the lungs, okay. It is a disease of the lungs, and it is generally caused by a bacteria, TB bacteria, okay. And it is an infectious disease because it can infectious or communicable disease because it can transfer from one person to another, and it can transfer through like air, or whenever you are changing meals and stuff like that, okay. Is it clear?
Yes, ma'am.
Okay, Himanshu, I'm gonna give the uh, PDF. No need to take screenshots, I'll give the PDF. Okay, I think you don't have any more doubts. If you have doubts, you can ask me next class also, okay. Next class. Okay, thank you.